Hello and welcome back. Today we shall be covering cerebral palsy, starting from the definition, causes, classification, features and treatment. Cerebral palsy is a permanent, non-progressive neurological disorder that is the leading physical disability in children with a prevalence of 1 to 3 per 1,000 live births. Cerebral palsy is known to have a significant motor component or effect, and its presentation changes over time due to an increased developmental challenges. Cerebral palsy is known to affect the cerebral cortex, that is the cerebrum, the basal ganglia or the cerebellum. Though in other cases it can affect multiple areas, causing a mixed type of cerebral palsy. Cerebral palsy can be classified based on the type of the motor problem or based on the distribution of the motor problem. When classified according to the type of the motor problem, we have 4 types of cerebral palsy. That is the spastic type, dyskinetic type known as Athetoid type, ataxic type and a mixed type. The spastic type is the one that involves the cerebrum and is the most common, accounting for about 70 to 80% of the cases. This type is associated with an increased muscle tone and stiffness and also muscle tightness. The second type, that is the Athetoid or dyskinetic type, accounts for about 10 to 20% of the cases and it's associated with uncontrolled movements. This occurs when the basal ganglia is involved. The third type of cerebral palsy that occurs rarely is the ataxic type. The ataxic type occurs when there is a cerebellar involvement, and in these cases it accounts for about 5 to 10% of the cases, and the children who have ataxic type present with difficulties in balancing and coordination. And when these children have features or symptoms of more than one type, they have a mixed type of cerebral palsy. When cerebral palsy is classified based on the distribution of motor disorders, they bring forth 4 types of cerebral palsy. That is the monoplegic, hemiplegic, diplegic, and quadriplegic. The major causes of cerebral palsy remain unknown, but can be associated with prenatal conditions, for example the stroke and infection in pregnant mothers, which account for the most common cases. Post-delivery infections, for example meningitis and kernicterus, account for about 10 to 20% of the total cases, and in other cases perinatal asphyxia in minority can account for 10% of the total cases of cerebral palsy. When we look at the symptoms, we have delayed motor milestones, asymmetrical movement patterns, abnormal muscle tones in these patients, and these patients usually are associated with poor feeding or irritability problems. A spastic cerebral palsy has features of increased tendon reflexes, tremors, weaknesses, muscular hypertonicity, and characteristic scissors gait while tall walking. The second type, that the Athetoid or dyskinetic cerebral palsy, is characterized by abnormal slow writhing movements of the hands, feet, arms or legs that are exacerbated during periods of stress and usually absent when the patients are asleep. The third common type is the ataxic cerebral palsy. Like we said, the patients usually have problem with their balancing and gait. They will present with a wide-based gait and intention tremors that complicate performance of daily activities and therefore requiring a fine motor function. Children who have cerebral palsy sometimes may exhibit cognitive and sensory impairment, epileptic features, and nutritional deficiencies. What are other differential diagnoses that can come to your mind when you see a patient you're suspecting to be having cerebral palsy? We have mitochondrial disorders, arginase deficiencies, glutaric aciduria type 1, Rett syndrome, Leishman syndrome, and Niemann-Pick disease type C. The diagnosis of cerebral palsy is based mainly on the clinical assessment of these children and not on the laboratory testing or any neuroimaging modalities. Observation of a slow motor development and abnormal muscle tone and unusual posture can give you a clue that this baby or newborn is suffering from cerebral palsy. The complications that can be associated with cerebral palsy are like intellectual and cognitive disabilities, visual problems in about 45% of the cases, hearing deficits, and some health problems, for example, constipation and growth problems, epileptic features, osteopenia, mental illnesses, and undescended testicles are common in these children. Motor disorders associated with cerebral palsy include dystonia, spasticity of the muscles, tense muscles, and urinary incontinence. The management of cerebral palsy is mainly collaborative with other team members. Since cerebral palsy is a permanent chronic condition, it has no cure, and therefore the goal of management or treatment is to improve the quality of life of these babies. In these cases, we can manage each of their disorders. For example, intellectual and learning disability can be sorted with a special education teacher for these patients. Visual problems can be assessed by an ophthalmologist or an optician, and this correction can be done using glasses. Hearing deficits can be assessed and screened for in these children. Constipation can be prevented by an increased fluid intake, enough fiber intake, mobility, and probably introduce laxatives to the diet of these babies. Growth problems can be sorted by either monitoring their feedings, and may have to introduce feeding through a nasogastric tubing or a gastrostomy tube. Antiemetics can be used in management of gastroesophageal reflexes, and in the cases of undescended testicles, surgery may be indicated. Anticonvulsants can be used in the management of epileptic features in these children, and osteopenia can be controlled by monitoring the vitamin D levels of these children, introducing daily sun exposure, and a psychiatrist can assess these patients for any probability of mental illnesses.